Hi, my name is Robert Stack. I'm a licensed alcohol and drug counselor and a licensed mental health counselor. I've worked at the retreat for about the last 28 years. For most of that time, I've worked with dual disorder clients, and that means that they have an addictive illness and a co-occurring mental illness. The most common one of all that would be mood disorders, specifically major clinical depression. And so what I was hoping to do is share with you some things to look for in depression, some things to be aware of. I worked with a doctor, Dr. Todd Mandel, who used to school us and say, don't tell me a patient has depression, just tell me what you see or what you hear. And that's really what I would like to focus on, not so much a diagnosis, not so much like someone has clinical depression or something, but more this idea of being aware that maybe somebody is suffering. So I'll just go through a list of some of the symptoms. I won't go through all of them, but I'll go through some of the symptoms and talk a little bit more about this. Probably the first two to think about are the physical symptoms. I always go there first. The first one would probably be weight gain or weight loss. And what you're looking for is a percentage of weight over a period of time. In other words, if you gain 25% of your normal body weight over a short period of time, or the opposite, if you lost, say, 30% of your body weight over a short period of time. And again, what you're looking at is either somebody who has stopped eating or someone who is eating continuously. Rapid gain loss or rapid weight gain. The other one, and by the way, a couple of times when I'm talking about this, you're going to notice I'm going to say the opposites. They're restless or they're not doing anything. They sleep or they sleep too much. And a lot of that is sort of, you have to look to see what's their normal and what's different about them. So the first thing, like I said, the first thing would be appetite. It would be physical, losing weight or gaining a lot of weight. The second one that sort of becomes something that you can almost measure is sleep disturbance. And that sleep disturbance could either be someone who has trouble getting to sleep, or someone who is tired or they're exhausted and they're laying in bed and they're watching the clock tick away and the numerals fall and yet they can't get to sleep. Or someone who falls asleep but wakes up in the middle of the night and can't get back to sleep. And of course the third one would be someone who's in bed all the time. And again, you sort of look at this and it isn't like, well, one thing means one, it's more like this is not normal. This is different. This is not my normal sleep pattern. And it's gone on for a while. It's not just one night or a couple nights in a row. And it's not just I had indigestion or something like that. This is something different. I'm laying there. I'm exhausted, my head, my thoughts, and I just can't seem to get to sleep. Or I fall asleep right before dawn and then wake up and I'm tired. And I guess it's worth noting that for, sleep deprivation is really scary because, you can get very sick. I mean, it's so. Anyway, those are the two that you look for, sort of physical symptoms that are sometimes you can talk to somebody about or notice right away. They're always tired, they have a lot of fatigue, they tell you they're not sleeping, they're not eating, or they're eating a lot and they're staying in bed all the time. The other two things that you should always notice are, they're sort of the same coin, but on one side is the fact that they're very sad and depressed and they have feelings of sadness. It's more than just a day and it's more than just a mood. It's an extended sense of sadness, and it doesn't pass. It isn't just a blues. It isn't just like, gee, it's a dark day or I'm having a bad time today or something. This is something that sort of goes on and goes on for more than a week or two, and it's really a feeling of sadness, maybe doom and gloom a little bit. And the other side of that coin, and this is something that you look for, you'll hear somebody say, is that they lose pleasure in everything that they normally would enjoy. So you look at somebody that, I sometimes give the example of somebody who likes to go fishing or something, and they do everything they need to do. They get the bait, and they force themselves to get to everything and go down and get the boat and go out. And they get there and they realize that it's of no enjoyment, and they're not enjoying it at all. the it happens in different ways, and one of the things you'll notice is that even people who enjoy their work will begin to say that they don't enjoy something, or they're not enjoying work. They're not looking forward to it. And in some of my work with some of the men with dual disorders, with substance abuse, the other thing that sometimes happens is that people will lose some of enjoyment of intimacy. And that's something that we often don't talk about, obviously, and it's something that is often disguised, or people are hesitant to talk about it or bring it up, but it's actually a loss of pleasure. And for a lot of people, that's really, I mean, on some level, that's very worrisome. I don't seem to enjoy it anymore. I don't enjoy the things I used to enjoy. And this has gone on, like every day. This has gone on for a couple of weeks. So you sort of get this sense that there's this loss in pleasure in normal activities, things that I would normally enjoy. And also there could also be this sense of sort of sadness, if you will, or pervasive sadness, if you will. The other ones, a couple other things to look for is sort of what they call psychomotor, kind of, in other words, like a restlessness or an agitation. Most people assume that people who are depressed are looking at the ground or not moving or holding their head, and of course that happens, but it can also show up in a sort of restless, going from one room to the other room, a certain amount of agitation, putting things down, picking things up, not completing tasks, not getting anything done but feeling very busy, feeling sort of confused. And this sort of ties into something that has to do with lack of concentration, inability to complete tasks, inability to stay on task. But it's really, and again, I want to point out that this is different. This is not how you normally act. This is not attention deficit or anything else. This is just, I just can't get anything done. I don't know what to do with myself. And it's a sort of, and again, you know, you have this sense of loss of energy. You might have a sense of, you know, trouble with sleep and trouble with appetite. And now you're sort of back and forth. You're sitting still. You're turning things on, turning things off. And in the middle of that, I mean, you also have to worry about that you begin to get messages about yourself. And I say messages, I don't know, thoughts is probably the right word, but it's more like very critical thoughts about yourself. Feeling very guilty, not about something you did, but just guilty about who you are almost, a sense of worthlessness, a sense of there's no future for me. Everything I do, it fails. I'm not good at anything. I mean, it's a very sort of dead-end kind of feeling. When I teach cognitive behavioral therapy to clients, we spend a little time talking about cognitive distortions. And one of them is a sort of all or nothing thinking, words like never, no one. And that can be really dangerous, this a combination of what they call emotional reasoning and all or nothing thinking. It's sort of, nobody loves me, or nobody's ever cared about me, I'm unworthy, I'm not good enough. And one of the problems with this is that most of us trust our brain, that our brain is acting on our side, and that the messages that we get from our brain are sort of valid or truthful. They are real. I mean, I don't want to imply that they're not real. They're very real, but they may not be true. So when someone says, no one cares about me, I can't do anything right, I've never been any good, those are very real feelings. I mean, they're not like fake feelings. They're very real, but they're not true feelings. But the problem with that is that other people can try and convince somebody that these things are not, they're not true. Like you'll try and tell somebody, oh, no, we do care. So, but to a person, and I think we all fall to this. I mean, we have a hard time believing that what we think is not accurate. I mean, it's sort of, we so depend on our brain. I mean, it's one of the delights of magic or illusions or something, is that, like when we realize that we've been tricked or something, that something we thought was there is not there or something. So of course, this is more serious than that, but the reason I make such a point of it is that it's irrational. It's not rational thought, but we assume it to be true. And this is when you begin to make sort of self-harming statements, but you begin to justify them, you begin to rationalize them. They'd be better off without me, or nobody would miss me, or and of course this is where it gets really dangerous. You begin thinking about death, you begin thinking about plans, or you begin to think about methods and stuff. And I have to say that at that point you have to call somebody. You have to talk to somebody. I mean, all these other ones you can sort of muddle around and have them and sort of struggle with them, but by the time you begin having this inner dialogue with yourself about suicide or about self-harm or about the value or the, what does it mean or how it could be done, I mean, you have to decide to go get help. Now, having said that, and I mean, I have to recognize that people who are feeling this way may very well disregard what I have to say. So what I want to offer is that maybe you know someone who's having these struggles. Many times we'll notice that someone is depressed, and you'll even say things like, I just want the old you back, or what's wrong with you? And a lot of times when you'll ask people, are you okay? And they'll say, I don't know, is something wrong? And they'll say, no, I'm okay, I'm all right. And part of that is because not all depression is caused by something visible. So a lot of times people who are depressed have like unknown origins. They don't know why they're depressed. They don't have a reason why they're depressed. And sometimes there are reasons, sometimes there are things, and they call that reactive depression. But I wouldn't really worry about that. I mean, it's sort of like if you're depressed, you're depressed. I don't know how you got there, isn't that important. But what's important is that if you see somebody, if you notice somebody, don't hesitate to ask them. I mean, most people who are depressed really do want to get better. I mean, they do want help. They just don't know how to get it, or they don't know if they can talk about it, or they may not even know that there's something wrong. So I guess, there's a couple things to look at. I mean, obviously that being one of them, but sometimes if there's a family history, you say a family history of depression, somebody might be aware of depression, or they might know about somebody who's depressed. We do suspect in some cases that depression is genetic, and that people who had depressed parents sometimes are at higher risk for depression. Sometimes if one of your relatives have committed suicide, your risk factor for suicide is greatly increased. These are things to be concerned about. But what I'm most concerned about is people who are suffering, and most of the time they feel hopeless. And they need to know or need to hear, and there are people, professionals, psychiatrists, psychiatric nurses, social workers, psychologists. I mean, there are people who can be helpful. We have a wide array of antidepressants. Many of them are very effective, and we can try different ones, and different ones work better with different clients and different things. So I mean, I think if nothing else, I mean, a person who is depressed is sort of afraid that the way they felt yesterday is the way that they're always going to feel. And that's why they say, like, I can't go on this way. What their concern is that they're always going to feel this way, that they can't keep feeling this way. And it's not necessary. And so if you can intervene and tell somebody, no, that people do get better, there is hope, there is recovery, talk to somebody, get some treatment. Believe it or not, I think most people will go. I mean, maybe you give them a ride, maybe you make it, do what you can for them. But I think it's so important for people to offer help and to offer encouragement. And I ought to say just a little bit more about, I mentioned earlier with dual disorders. People who have co-occurring like alcoholism or drug dependency, there is such a thing as substance-induced mood disorders. And that means that the drugs that you're taking have sort of induced this mood disorder. And the answer to that is usually stop drinking, stop using, and usually the depression will get better. Having said that, I would say that for a lot of people, these are two independent illnesses that you now have. Now, which one of them came first is not, I mean, academically you could be curious, but if you have both illnesses, it's very, very important that you get yourself involved with recovery, but also at the same time to get help for your depression. And not just assume that because you stop drinking you're going to feel better or that things are going to get better, because sometimes alcoholism and drug addiction can mask the symptoms of depression. I mean, obviously, if you're taking drugs, you may have a sleep disturbance. I mean, you may, because you're passing out, or you may have loss of appetite. You may be restless and agitated because of withdrawal. You may have negative thoughts about who you are or what you've done. I mean, so a lot of the symptoms of alcoholism and drug addiction were sometimes can look or seem as if the same thing as depression. So it is important that if you have both illnesses, that you have to treat both of them. But don't ever think that you have one and you don't have the other. So like some people say, well, I only drink because I have depression. Well, there's a good chance you drink because you're an alcoholic. And just getting treatment for your depression probably won't really help much with your alcoholism. And as a matter of fact, your alcoholism will interfere with your therapy for your depression. So I just wanted to add that in. I mean, because there are people who have dual disorders, and you need to understand that you need to treat both of them. And a good model for depression, I know, for one thing, would be 12-step programs, some form of abstinence, support, psychopharmacology, some medication, and probably talk therapy. And that's a nice combination to deal with dual disorders. The other thing I should mention, I don't want to make it, is sometimes depression is mixed with what is called manic episodes, and that's called bipolar illness. And the idea is that you have bouts of depression and then you have very manic behaviors. It's a funny diagnosis in that some alcoholics are misdiagnosed bipolar, but an awful lot of alcoholics aren't diagnosed. Now, I can't explain how that happens, but bipolar illness, again, if it occurs, you'll see people who don't understand your behavior and don't understand when you're manic what's wrong with you. And then, of course, when you're depressed, you're almost the opposite. And I think on some level that becomes a little bit more obvious. I'm hoping that it is anyway. So that's the other thing. And then, so when I thought about doing this, all I really want to say is to people is that, depression happens to all of us. It has nothing to do with intelligence or morals or social status. It happens to children, it happens to adolescents, it happens to the elderly. It sometimes is associated with other illnesses. The thing to know is that if you know somebody and you feel that they've changed, if you feel like that there's something wrong, say something, ask them, talk to them. And don't just ask like yes or no questions, open-ended questions. And sometimes people who are depressed, they have trouble speaking, and they'll sort of pause in between words. And you may be tempted to give them the word, but try not to do that. Be patient with them. Try and see if you can get them to talk and trust you and to begin to tell you some of the thoughts they've been having. Because again, you want to look at the physical characteristics, the sleep, the weight, the motor activity, agitation, restlessness. Then you want to think about the words that they say, what do they say to themselves, how are they talking to themselves, and what are some of their thoughts about the future and what else is going on, and any thoughts they have about self-harm or death. So I don't want to turn anybody into like counselor or anything like that, but I am concerned is that there are people who would never go to a psychiatrist or a psychologist who are suffering from depression. There's probably adolescents who have depression, and people just tend to look at their behavior and they don't see that there's something else going on. And so, well, That was my intention. And I said this earlier, and I don't mean to be over melodramatic, but I really believe if you can say something, save a life. Reach out to somebody. If you're concerned about them, if you're worried about them, if you're thinking that there's something wrong, say something to them. And if need, talk to somebody else about it. But see if you can get that person help. Thank you.